Hi class, today's lesson will focus on the many aspects of performing the cross-matching procedure. Our learning goals and objectives are as follows. Goal: the learner will demonstrate the ability to perform a cross-matching procedure and identify suitable donors. Objectives: the learner will be able to explain the concept and purpose of performing a cross-match. Using a standard procedure, the student will perform a cross-match on patient and donor samples to identify compatibility status. Given a scenario, the student will determine why the donor is incompatible with 100% accuracy. After the lecture, the student will justify why delaying a cross-match is necessary in certain circumstances. To start, we will identify the purpose of this method. The cross-match procedure is used to determine compatibility between donors and patients who will be undergoing a procedure for either a blood transfusion or an organ transplant. This test enables us to directly detect incompatibilities that will be manifested as chills, fever, shortness of breath, pain, and even death. The key factor that causes these reactions are antibodies found in the patient's serum. Detecting these antibodies prior to a patient's procedure is paramount. However, there are some cases in which the cross-match procedure will be delayed. For example, if a patient is suffering from massive blood loss, blood needs to be given immediately. Under these circumstances, the donor segment is cut and will be used for the cross-match procedure after the patient is stable. Generally, O-negative blood is given since it can be donated to any other blood type, but that doesn't always mean there won't be an adverse transfusion reaction. Once the lab receives the patient's specimen, the cross-match is performed on the donor segment and the results are expedited to the physician to notify them of any possible incompatibilities. There are two types of cross-match procedures. The most common cross-match utilized is the major cross-match. This test is performed using patient serum and donor red cells. The major cross-match is used for patients who only need red blood cells transfused. The minor cross-match test is performed using patient red cells and donor serum. This test is used for patients that will only be receiving a serum transfusion. The key to a successful cross-match is the identification of the antibodies and antigens present in specific blood types. For example, a patient who is type O has no antigens on their red cells. Being that they lack all antigens, they make all antibodies. In order to make an antibody, you must lack the antigen. So a type O person makes anti-A, anti-B, and anti-AB. If they make all the antibodies, they cannot receive any other blood type except type O. Let's take a look at the A-positive patient. An A-positive patient has A antigens and Rh antigens on their red cells, and they make anti-B antibodies. This patient could only receive red cells from another A patient or an O patient. The same principle applies to all the blood types, whether they be Rh positive or Rh negative. Hopefully, these images can provide a visual to go along with understanding the concept. Now we will review our pretest questions. Question 1. Which word is equivalent to cross-match? The answer is D, compatibility testing. Adsorption, antibody screen, and antibody identification are all different techniques that can be used in the cross-match procedure. Compatibility testing is the correct answer because we are now testing to see if the two blood products are compatible to sustain life. Question 2. What does compatibility testing include? A is the correct answer. All the other option choices relate to compatibility testing, but do not state all the steps involved in a complete compatibility test. Question 3. What samples are used during a major cross-match procedure? The answer is B. Again, the major cross-match is for patients that require donor red cells. We are testing to see if the patient has an antibody in their serum that will bind to an antigen on the donor's red cells. Choice A describes the opposite of this. This describes a minor cross-match. Option C will yield no results because only antibodies are present in both specimens. And option D also utilizes the patient's cells in the donor serum. For the sake of time, we will only review the key points of the cross-match procedure. After performing the ABO, Rh, and antibody screen, we move on to the cross-match. Start with making a 3 to 5% cell suspension of donor red cells. Next, add the correct ratio of donor cells to patient serum. 2 drops of donor cells and 1 drop of patient serum. This ratio is important because any excess of red cells in serum can lead to a false reading. An excess of red cells indicates post-zone, meaning we have too much antigen present, and an excess of serum indicates pro-zone, meaning we have too many antibodies present. The ratio must always be in the zone of equivalence to result in lattice formation, which is identified as agglutination. We then centrifuge and check for agglutination. This is the immediate spin phase. If no agglutination occurs, we add Lys enhancement to the tube and incubate at 37 degrees Celsius and centrifuge. This is the enhancement phase. If no agglutination occurs here, we wash the cells and add AHG reagent to the tube and centrifuge. If no agglutination occurs in any of the phases, the patient and donor specimens are compatible. If agglutination does occur in any of the phases, the donor is incompatible. We check for agglutination in these different phases because different types of antibodies are presented under different circumstances. For example, IgG antibodies are present at room temperature, which we would find in the immediate spin phase. However, IgM antibodies are present at body temperature, which we will find in the enhancement phase. Now, form 4 groups amongst yourselves and work out this scenario. You are working in the blood banking lab and receive a specimen that needs a cross-match. Attached to the specimen are 2 donor units that will be used for the cross-match. You are provided with the patient's and the donor's blood types as listed in the following slides. Choose wisely, the patient's life is in your hands. Each group will be given a patient specimen and 2 donor samples. Based off the information provided, which donor would be suitable for the patient's blood transfusion? Group 1. Patient A is AB positive with a negative antibody screen. Which donor have you chosen to transfuse the patient with? Both answers are correct. However, type-specific blood would be more accurate. Since patient A is AB positive, they can receive all blood types. The Rh factor does not matter in this situation because patient A is Rh positive and does not make the Rh antibody. Donor 1 has the Rh antigen and donor 2 lacks the Rh antigen, resulting in no reaction. Group 2. Patient 2 is A negative with a positive antibody screen. Which donor have you chosen? Donor 3 is correct. Donor 3 is O negative, which is the universal donor. Donor 4 is A positive. With the Rh antigen present on these red cells, the patient's Rh antibodies will react and cause agglutination with donor 4 red cells. Group 3. Patient C is O negative with a positive antibody screen. Which donor have you chosen? Donor 5 is correct because it is type specific and type O patients can only receive type O red cells. Group 4. Patient D is B positive with a negative antibody screen. Which donor have you chosen? Donor 8 is correct because the patient makes the anti-A antibody, which would react with donor 7, but not with donor 8. Type O patients do not have any antigens on their red cells. I hope this lesson helps you better visualize and understand this concept. Now let's answer some post-test questions. A patient comes into the hospital and is in need of a blood transfusion for an upcoming surgery. The clinical lab scientist first performs an antibody screen and the results are positive. The patient was also noted to be B positive. After further tests, the patient has presented with an anti-K antibody. Which blood type is compatible for the patient? The answer is D. The same process used in the previous scenarios applies to this question. Being that the patient is B positive, we would prefer B positive blood. However, the patient has an anti-K antibody, so whatever blood type given must lack the K antigen, which is answer choice D. If the patient received an incompatible blood product, what reactions would the patient exhibit and what observations did the clinical lab scientists have seen in the lab? The answer is A. It would be expected to see agglutination for all incompatible samples. And as mentioned previously, some of the key indicators of an incompatible blood type are fever, chills, and pain. The patient begins to hemorrhage and needs a transfusion immediately. There is not enough time to perform a cross-match. What blood type would you give to the nurses under these circumstances? The answer is D. Under all emergent situations, give O-negative blood. O-negative blood lacks all ABO antigens as well as the Rh antigen. An ABO or Rh transfusion reaction arises quickly and often ends in death, so it is much safer to transfuse O-negative blood if the cross-match procedure must be delayed. To aid in your learning, I have assigned a take-home case study worksheet. The same principles learned today apply to this case study. Use your critical thinking skills and answer these questions. We will review the answers at the beginning of the next class period. All right, everyone, have a nice day. Email me if you have any questions.